So when you open up Blue Sky Plan, you'll see this screen with your cross-sectional screen, your axial screen, panoramic screen, and the 3D screen. The first thing we recommend in this case is to go to the 3D screen and select the articulated model. What this does for you is it provides the outline of the opposing tooth in your cross-sectional view, as you can see right here. We next would go to the panoramic screen, and here we would size the implant. This is maybe a 5 by 11.5 implant. And then we use the abutment as a virtual tooth. In this case, the abutment was sized at about 10 millimeter diameter. So you can move this into position, and you can see your mesial distal orientation. You can move your abutment against the distal of the tooth, and right off the bat, your implant is in a pretty nice position. We next go to the cross-sectional screen, and here you can see the implant is placed. I can see the outline of the crest, so it gives me some indication right now of how thick the gingiva is over the implant, and that has implications for the vertical placement of the implant. Secondly, the center line of the implant, in this case, was arranged to meet the lingual cusp of the opposing molar, as it should be. And so now the mesial distal orientation of this implant is set quite easily. We then go back to the 3D screen, and we select centered model. The centered model is a 3D image of a model in which there is a reference point, and that reference point is in the ideal location for this implant. For a second molar implant, the entry point would be 6 to 7 millimeters from the distal of the adjacent tooth. And then we can see where the center line of our implant is relative to this ideal position. You may not always be able to get it in the ideal position, but at least you know where you are relative to the ideal position. And this is one way in which you can overcome the looking at 3D in 2D problem, because this is based on the ideal position is based upon a model, which you can see in hand, not on a 3D and 2D. You can also then look at this and use the abutment as a virtual tooth and see quite accurately exactly the relationship between the future tooth and the adjacent tooth. Finally, you can look at the occlusal relationship, and you can see exactly where the center line of the implant will meet the upper molar. And as a final quality control test, you can look at all the views and just check it out to make sure everything is okay, and then this plan can be submitted for fabrication of a drill guide.